Welcome back. The debate over health care reform is raging across the country this month.
Somebody might lose their job. What are you going to do about it then? But Rush Limbaugh tells us what to think, and he tells us what to do.
Your government has lost the faith and trust of the American people.
To quote someone, I think some of these leaders have acted stupidly.
This is really not about health care reform or insurance reform. It's a bill about government control.
The president is now supporting genocide against the American people.
Members of Congress who usually get to take it a little bit easy in a non-election year in August have been the target of a lot of the volume you just saw right there. Joining us now, two local congressmen who are hearing an earful from their constituents. Democratic Congressman Anthony Weiner, he represents parts of Queens and Brooklyn, and Republican Congressman Scott Garrett from New Jersey. He represents several northern New Jersey counties. Welcome to you both.
It's good to be with you. Thanks.
Congressman Garrett, we'll start with you. For both of you, real quick.
Okay.
And this bill is 1,000 pages long. Okay, and I understand we don't understand necessarily how the legislative process works, but there's no way anybody can read 1,000 pages before they vote on it, right? Can you read an entire 1,000-page bill?
No, and well, you can read the bill, but can you do it before you vote on it? And there's really the rub. I mean, with the cap and trade bill, no one read that bill before those people who voted on it last time. And Speaker Pelosi wanted to vote on this bill last Thursday or Friday before we went on break. But I can tell you, no one in Congress would have voted knowing.
Congressman Weiner,
I hate to say it, I'm one of the people that did, but I'm on the committee and I sat through the 78 hours of hearings and the 42 hours of markup. So I actually did.
All 1,080 pages?
Unfortunately, I have the dog-eared copy from coast to coast.
But your colleagues can't read it all.
Well, look, I mean, the fact of the matter is that we actually have 4 bills now. You have a couple that have come out of different versions in the committees, in the House and the Senate. This is not unusual, and it's true what Scott says. You know, if you read a bill, even if you read it, you know, 50% of it is references to other bills, but, you know, this a little bit misses the point. In fact, what's going on here is people have to make a basic decision, and I think a lot of Americans understand this, that we have to figure out a way to control the cost of health care. We're all going to be bankrupt. We're going to lose our insurance at our work. We're going to lose the ability to fund Medicare. So we have to do something. Now, there are some people who are saying, no, do nothing. But I think most of this discussion is among people who want to try to solve this problem.
Congressman Garrett, what is your position on the bill?
Yeah, I don't know that I've heard anyone who says no, do nothing. I think everyone I've talked to from both sides of the aisle says we have to do something reform, that we are systemically problematic right now because if we do nothing, we'll be out of control for our spending. So we need to do something, but not so quickly. And if he's right as far as saying 50% of the bill refers to other portions of legislation, has anyone read all those other pieces of legislation?
Have either of you ever seen this kind of furor from your constituents? Congressman Weiner, I know you had a lot of people talking to you yesterday.
You know, I got to tell you, you know, frankly, the heat is getting exaggerated. People have questions. 100%. Look, it's in your interest.
I've never seen anything like that. People yelling at their members of Congress like that, confronting a senator, getting into his face.
That happens at every town hall meeting.
Like this, consistently.
You see, I want to tell you some great. If you'd like to, and you can go to my website and take a look at the full length of these town hall meetings. The guy who yells gets on Fox 5, and Fox 5 wants him to yell.
No, we don't. No, we don't, Congressman Weiner. No, we don't. We're there to cover it. We're not egging these people on.
The fact of the matter is that the conflict is good for your TV, and that's why people do it. And that's the fact of the matter. This is a very important issue, and people have a lot of questions about it. But I got to tell you, I had a town hall meeting yesterday, not a single person raised their voice. Not a single one. Not a single person yelled out anything nasty. Not a single question went unanswered. And then everyone left, and they felt better because they had a chance to have the conversation. But does that mean that people don't go to the things and yell because they know it's going to make a good YouTube sensation, and you guys are going to like to cover it? 100%. You're complicit in it. That's all I'm saying.
All you're saying is we're complicit in this course, in those incidents.
In the cycle of amping up the passions.
Okay.
I mean, is it good
Congressman
TV,
Garrett,
Scott?
hold on a second.
TV?
All right, so is this all about good TV, Congressman Garrett, or do these people have legitimate concerns?
I don't think
that was a false choice, Greg. Yeah. I made exactly the point that people have legitimate concerns, but that's not what you're showing.
Congressman Garrett? I don't think you're complicit in anything. I think, if anything, you're just doing your job of making sure the American public sees what's going on out there. And I've never seen anything like this.
You haven't. Neither have I.
In my career as a state legislature and now my 6 years in Congress. And the people are, it's not overblown, people are rightfully concerned about something that is so overly fundamental to your daily living. saying. Whether there's going to be some bureaucrat between you and your doctor is some fundamental to the way we run our lives. Whether you're going to have a government-controlled healthcare system or a privately controlled healthcare system, whether you're in charge or with somebody else is in charge, that gets to the root cause of what everybody lives about.
If you don't want to, I assume your constituents will be happy to hear that you don't support Medicare, which is a single-payer, government-controlled health care plan.
I don't support
the VA, or the Department of Defense.
Of Medicare right now, I think
not
sustainable.
Let me just finish my thought. Look, we can say that. Oh, I don't.
Before your thought puts words in my mouth.
You're saying that you want government getting between patients and their doctors. Look, 40% of the Americans right now have a government-run health care plan that has a 4% overhead compared to the insurance industry that you're defending that has a 30% overhead in profit.
All right, Congressman Garrett, your response.
Well, he's trying to put words in other people's mouths, and I think that's what the American public is dissatisfied with the representatives. The American public wants their representative to be listening to them and not saying what there's on their minds. Medicare is not a sustainable structure right now. We know that. Every expert from both sides of the aisles who come before the Budget Committee says if we do nothing with Medicare, it'll basically bankrupt the country. So we have to change that. Americans may like the way that system works right now, but we know we have to make some changes to it. And that's what the American public is asking for. The American public is also asking that we take a step-by-step approach. Read not just the entire bill, but read all the references in the bill legislation as well. Know what we're voting on. And at the end of the day, come up with something that's sustainable, that puts the patient in charge and the doctor in charge, and not the government in Washington bureaucrats in charge.
Congressman Weiner.
Well, listen, I offered my Republican friends in the Energy and Commerce Committee a chance to vote up or down on single-payer national health care in the form of Medicare. Everyone said, we want Medicare to remain the same.
Well,
Medicare is a government-run plan that doesn't put profits in the pockets of
Okay, not everybody's thrilled with the way Medicare is managed. And a lot of people.
Medicare is managed? No, the management of it is the problem.
Concept is nice.
And the execution is nice, and it works.
Execution?
100%.
Congressman Garrett?
Now hold on a second. The cost is high.
The execution is not nice. I mean, if your office is like my office, and you know you get complaints about that. But I'd be curious about one thing in your committee, because I don't know the answer to this.
Sure.
I know in other committees a Republican amendment was put up and was voted down. Maybe it wasn't your committee to say that any member or the Congress who votes in favor of this, or Congress in general, should have to also have the same system that the American public does. That is to say, if we're going to have a public option, as Obama wants, shouldn't Congress have to be in that as well? I say yes. Do you agree with that? Did you vote on that?
I'm going to choose the cheapest one because I'm in good health, but language is in the bill that says that all members of Congress can opt in just like anyone else.
All right, gentlemen, do me a favor.
Everyone is going to have an option under the Obama plan. I want Medicare for all Americans.
Do me a favor. I'd like you to stay here, actually, join our web show, if you would.
Sure.
myfoxny.com. They can watch this conversation live. And, folks, if you have questions for them, log on, again, to myfoxny.com. They'll be having this live, ongoing chat simultaneous to our program. So thank you very much, Scott Garrett, Anthony Weiner.